Hello, I'm Susan Tomasich. Today I have with me Karen Townley, who's going to give us a presentation on HICAP and the Senior Medicare Patrol, which is
Yes.
something I've never heard of before, so I'm really excited to hear more about that.
Super, great.
So Karen, let's start with how you decided to become part of HICAP.
Oh, well,
Just a little background.
just an interest in helping people. My husband worked at the Area Agency on Aging in Santa Clara County, so I knew of them. I knew of HICAP. So when we moved up here 5 years ago, saw a little blurb in the paper about, would you like to become a HICAP volunteer? So I signed up, went through the training, so I've been doing it for about 2 years.
Oh, that's wonderful.
Mm-hmm.
And do you guys have enough volunteers, or should we also be telling people out there if they'd like to
Oh my
follow
gosh,
in your
yes.
footsteps?
Yeah, we never have enough volunteers.
Okay.
I do think a ad win in the Union Democrat, of course, that's just in Tuolumne County,
Sure.
for volunteers. So, yeah, we're always looking for new people. So, absolutely, if you'd like to do it, if you think that would be a role you'd like to take on, please absolutely reach out to us.
That sounds wonderful.
Absolutely.
All right. Well, without further ado, why don't we have you give us your presentation?
Super. Thank you, Susan.
Thank
So
you.
again, I'm here today to talk about HICAP and how it can help Medicare beneficiaries. So I'll be talking today about what HICAP is, what we can assist with, where we're located, why HICAP is so important to Medicare beneficiaries, and when to call us. So let's start with what HICAP is. So HICAP
Right.
stands for Health Insurance Counseling and Advocacy Program. And it is available to provide confidential and one-on-one counseling, education, and assistance to individuals who are either currently on Medicare or are new to Medicare and their family members. We offer free and unbiased information to Medicare beneficiaries to help them make educated decisions on their health care options.
Let me stop you right there
Sure.
for a second. Now, how does HICAP coordinate or work with, there are private people also that provide Medicare counseling. So what is the difference between HICAP, going to HICAP, and going to a private person that provides Medicare counseling? They're probably a broker, insurance broker.
Well, there's brokers. Brokers will help you with Medigap and supplement plans.
Okay, thank you.
We can provide education, and we do that all the time.
All right.
So we can compare supplement plans. We could run you a quote. We can discuss all that. We cannot sell you a Medigap plan, but we empower
perfect.
you. If you don't want to go through a broker, you can do it yourself.
Okay, that sounds
Okay?
great.
Yeah, absolutely.
All right.
Super. So what kinds of things can we assist with? So we just talked about supplement plans. We can educate people about supplement plans and review them and compare them for you.
Okay.
We can educate people on how to sign up for Medicare.
You know, and that's really important.
It sure
because-
is. And the enrollment periods, right? Because people
Absolutely.
they don't necessarily know when to do it, right?
Absolutely.
So, yeah, so we can clarify that. We can help with Medicare billing concerns. Prescription drug plans we can help you enroll in. We can help you with prescription drug plan issues that you might be having. We can discuss Medicare Advantage, offered in not all of our counties here in Area 12, but some of them do have them, and we can discuss those kinds of things. Medicare fraud, which I'll be talking about in just a little bit. If you've detected something, we can talk to you about it, what it is, and we can help you report it so that it can be investigated.
Well, and I have to say that's really important information and help, because when I first signed up for my Medigap policy,
Mm-hmm.
and I think I'm a pretty savvy, technically able to use
Savvy.
a computer.
Mhm.
Yeah, I can use a
Sure.
computer, right? That's what I think anyway. But trying to figure out how to get to that Medigap I just had a hard time navigating that website. So I happened to be at the pharmacy in San Andreas, and the young man down there he told me how to do it.
Okay.
And he said, I help my parents with this all the time. So
Sure.
he said, if you get home and you're still having trouble, call me and I'll be happy to help you over the phone.
Absolutely. That
So,
sounds great.
It's so silly though,
Yeah.
that I had to ask a pharmacist to help me with my Medicare. So it just points out how important it is that HICAP is there and
Absolutely,
Yeah.
absolutely. And in HICAP, we have access to a website that the general public is not.
Okay.
So we can provide quotes, actually, specific to your county and your age, whether you smoke or not. So we can actually print out a quote for you and teach you how to read it. And we find it to be pretty darn accurate. If you go to the Medicare website and look for a Medigap plan, the prices are kind of nebulous, right? So we can give you a
agree.
lot more specific information.
Oh, that's-
And when to review your supplement plan. There's a specific time period every year to do that so that you're not subjected to medical underwriting, which you always want to be focused on,
Okay.
right? Medical underwriting are all those nasty health questions that they can ask you, right? So you
Oh, I
want to
didn't know
avoid
that.
that at all costs. Whether or not you have issues to report is irrelevant,
Sure.
right? You don't want to report that, it's none of their business, don't make it their business, right? So there's a specific time period every year that you want to review your supplement plans,
Okay.
right? And we can educate you about that too,
All right.
right? So yeah, so the fraud issues that might come up, we can help you report that. We educate people who are new to Medicare and what their options might be. As we discussed, the Medigap, we can certainly help with that. Long-term health care insurance, we have people who are knowledgeable about that, so we can educate people about that and help with billing issues
Okay.
that they might be having.
As far as long-term health insurance is concerned, I would imagine that if you're over 50, it's kind of probably too late to get a plan.
I am not, I am not trained on long-term health care.
Okay.
We certainly have someone on staff that is. Candidly, I would say 50 is not too late.
Okay.
Yeah, yeah. Now, if you're talking about 70 or 80, now, now we're getting, and of course your premiums, I would suspect, would be higher.
Oh, I
So
would
if you're
think
going
so,
to get
too.
it, the earlier you get it, the better. Of course, that means you're paying longer, hopefully, right? I mean, if you get it at 50 and you're living till 90, you're paying for 40 years. If you get it 70 and you live to 90, you're only paying for 20, but that premium will definitely be different between 50 and 70,
Oh, absolutely. Absolutely.
right? So,
So,
yeah.
okay.
Good. So where is HICAP located? So HICAP is located in every county in the United States, and it is through that county's Area Agency on Aging.
Okay.
So here in Area 12, we are made up of 5 local counties. So we've got Alpine, Amador, Calaveras, Tuolumne, and Mariposa. So again, our office is located in Sonora.
Okay.
We are open 5 days or 5 days a week, Monday through Friday, 8 to 5, closed at lunch. So we encourage people to call, whether they just have questions over the phone or if they'd like to come in and see us. So yeah, we're at 209-532-6272.
All right. And I see you have a national number down here, too.
Yes, we do. Yes,
So
we do.
why would I call the national number as opposed to just calling the local?
You wouldn't.
Okay. Because I personally trust my local people.
Absolutely.
That, I can look you in the eye and,
Absolutely. Oh my gosh, yes.
yeah.
Oh yeah, yeah. Yeah,
Okay.
I mean, which became certainly a problem during COVID.
Oh,
right?
that
When
was
we were shut
absolutely
down.
true,
I
yeah.
mean, all of our appointments were via phone, right? And that makes it hard.
It does make it
Well,
hard.
yeah, you can't establish that rapport, number one. And reviewing someone's prescription drugs over the phone can be challenging.
Oh, yeah.
Yeah, spelling it, that kind of a thing. So now that we're back to in-person appointments, it's a lot easier and yeah.
Well, and I think that if you have any kind of communication challenges, if your hearing's a little off or your vision's a little off,
Absolutely.
it can just be a lot easier to be in person as opposed
Absolutely.
to looking at a screen and, kind of, I don't know, it's not the same. That's all I can
Absolutely.
tell you is it's not the same.
Absolutely, for
So,
sure, for sure. So
yeah.
yeah, that's hugely helpful. Yeah,
Okay.
good, all right. So why is HICAP so important to Medicare beneficiaries? So our mission is to empower, educate, and assist Medicare eligible individuals with, through objective outreach, counseling, and training. And our vision is to be the known and trusted community resource for Medicare information. So our team, our volunteers, and our staff are highly trained and certified to assist beneficiaries by offering personalized assistance with Medicare coverage. So it's original Medicare, it can be Medicare Advantage, prescription drug plans, and Medigap, also
Okay.
known as supplement.
So are there any disadvantages to going to Medicare Advantage and then deciding that maybe you just didn't like the way it was set up and maybe the next year you want to go back off of the Advantage plan and just go back to your regular Medicare and your gap insurance and your drug policy?
There shouldn't be. So, I mean, if you're on a Medicare Advantage plan and you decide that it's just not working for you, there is a special enrollment period. Again, you can't just, change at the drop of a hat. There's a special enrollment period, so you can go back to original Medicare.
Okay.
At that point, you will need a Medigap and supplement plan, right?
Okay.
Because you can't get a Medigap plan under Medicare Advantage.
That's, I guess, where I'm concerned, because they have all these little punishments for not doing things the way the government wants you to do them.
Absolutely,
So,
and that's why you need to be educated and come in and see us.
exactly.
Yeah.
So that would make me a little hesitant to try to get back on a Medigap plan, because then I can't tell you this is true, but I would have the feeling that they're going to penalize me somehow for going back to a Medigap plan, and sometimes the Medigap plan isn't available anymore.
Well, but there's various plans.
That's true, but there was a higher level plan that was available.
Plan F.
Plan F that's no longer available, so.
It is if you have turned 65 by the year 2020. So if you're signing up for a Medigap plan now and you turn 65 in 2020, you are still eligible for an F. Okay, the next plan down from that is a Plan G.
Right.
And the only difference between the two is the Part B deductible, which is $226 per year. That is the only difference between an F and a G.
Okay.
And the cost difference in premium between an F and a G can be substantial.
That's
So if you're-
amazing.
Yeah, it is. I mean, so if
If
you're,
it's only, if you're only saving $225 a year, then
Mm-hmm.
why should the premium gap be so much?
I think, my personal opinion is I think that the companies that are selling F want out of the business. And so
That's-
they're encouraging people to go to G,
Sure, that makes sense.
right? But if you do
Yeah.
the math, if you're okay to pay that prescription, that Part B deductible every year.
Right.
Now, 226, it goes up every year. Of course, so does your Medigap premium.
So does
Right.
your Medicare, so.
Absolutely.
Yeah.
I mean, it actually went down in 2023. Don't ever plan on that happening again.
Yes.
But it actually went down a few dollars in 2023.
That is true.
So, yeah, but that's the kind of thing we can help with Medigap, right?
Okay,
Yeah,
that sounds good.
super. So you definitely want to call us when you're new to Medicare and you
Okay.
want to help with how to sign up, when to sign up. You're confused about Medicare and the various options that you have,
I
right?
think we're all confused
Yeah.
about Medicare, but.
Exactly. Yeah, when to sign up, how to
Sure.
sign up. As we talked about supplement plans, comparing them, which one might be best for you. Again, we don't sell it, but we can
Right.
help with all of that. And again, as I mentioned, when is the best time to review your supplement plan? Because there is a definite time period every year that you want to do that, right?
So, okay,
Those might already be, people might already be on Medicare and they have questions or concerns that they want to talk about. Prescription drug coverage, they might have questions about eligibility or co-pays. They're having an issue that maybe we can help with. Help with filing an appeal,
okay.
okay? Challenging a denial, right? We can help with those kinds of things too.
I had no idea that you did all of that.
Absolutely.
That's amazing.
Yeah, it is not just open enrollment prescription Part D stuff, not by a
Okay.
long shot, right?
Great, I had no idea.
Yeah, yeah. How can we perhaps make Medicare more affordable for you? There is financial aid. Now, granted, you can't be bringing in a lot of money
Sure,
to get this aid, but it is available, right?
that's
So,
good to know.
absolutely. So we can talk about those limits, and if you're under those limits, you can get help with your prescription Part D drug plan, or to help with that Part B monthly premium.
And do you happen to know those limits off the top of your
I
head?
do not.
Okay, well, that's something that we can look up later.
Absolutely, give us a call. Absolutely. And for people who are still working,
Uh-huh.
we can help coordinate Medicare with your employer coverage.
Oh, that sounds like a good idea.
Absolutely, because you might want to stay with your employer coverage.
Sure.
Right? If it's cheaper, why would you go to Medicare?
So if you can still get employee coverage,
Mhm.
are you then gonna get a penalty if you go to Medicare later?
Absolutely
and
not.
as far as
But you have to prove that you had employee coverage.
Okay.
So that means going to your human resource department and they will provide you with proof of coverage.
Okay.
Medicare will absolutely insist on seeing that Because if you can't prove it, yes, there will be a penalty.
Okay.
But absolutely, I mean, if you work till you're 80, right, all you need to do is say, yes, I was covered under this employee plan for 15 years, here's the coverage, right?
Okay.
And that, at that point, you'll sign up for Part B. Now, you can sign up for Part A and should at 65 because it's free. As
Okay.
long as you've worked for 10 years, it's free. So why wouldn't you do Part A?
Sure,
But
that
then
makes
you can
sense.
add Part B later.
And then the drug plan
And
as
Part
well.
D,
You're not
of
gonna-
course.
Okay.
Of course, absolutely.
I'm really big on all these penalties. They kind of scare me because
Mm-hmm.
it isn't as if you hold off for a year or two and then you get penalized for a year or two. You get penalized for the rest of your life.
Yes, you
so
do.
it's not a little deal.
Right,
Yeah.
right. So yeah, the enrollment periods, it's really, really important to understand, right? Which is 3 months before your 65th birthday, 3 months after, and including the month of your birthday,
Okay.
okay? Super.
All right.
So that's HICAP. So anything more you'd like to discuss about that?
No,
Okay.
I can relate that I had an interesting situation where my Medicare started at 64 and 11 months because I was born on March 1st and they started my Medicare on February 1st
Oh, okay.
before I turned 65. So nobody's been able to figure that one out for me. It really doesn't matter. It's in the past.
Oh,
well.
okay.
I was
Okay.
just like, okay,
Yeah,
you know. So, and in fact, it cost me more when I went on Medicare than before because I was on the California,
Covered California, yes.
So I actually would have preferred that extra month not to be in there,
Right.
but you know, 1 month, what are you going to do? And,
Exactly.
at least it was
Exactly.
in place, and it's been a good thing for me ever since.
Good, good. And if you're
Yeah.
on Covered California, it is your responsibility to call them and let them know that you're going to be going on a Medicare. Okay, they are not automatically going to know that. They are not automatically going to stop that subsidy. So if you
Correct.
do not let them know, that subsidy will continue and you will owe it all back.
Oh, that sounds like a fun thing.
So it is your responsibility, right? I mean,
Yeah.
all of this is your responsibility, right? And people come in a lot and say, well, I didn't know. Understand, but the government expects you to figure it out.
Exactly.
Yeah.
All right. So we have a couple people here. Do you guys have any questions before?
I think it was already answered.
Fabulous.
Okay, great. Then let's turn. The
Senior Medicare Patrol.
I just
Absolutely.
love that name.
I know.
That's
I
great.
know. Yeah. So absolutely. So Senior Medicare Patrol, also known as SMP. So they have 3 goals.
Okay.
They provide Medicare fraud prevention education via outreaches, things
Okay.
like this, and health fairs and presentations. Reports or complaints that are reported to them via their hotline or through the
Okay.
local HICAP office, they address all of those concerns. And then they refer potential Medicare fraud cases to appropriate investigative entities.
Okay. So how do you become part of the Senior Medicare Patrol?
In terms of me, in terms of who?
Anybody? Who makes up the patrol, I guess?
Employees,
Employees.
right? So it's a group of people. Where they're located, I have no idea. Right,
Okay.
so this is not a volunteer organization. These are paid people, and this is what they do, is investigate fraud,
Okay.
okay? So their website is cahealthadvocates.org. It provides a plethora of information. You can even sign up for a monthly newsletter from them.
Okay.
So Medicare fraud is a huge problem. It's $60 billion a year, and that is considered a low estimate.
Okay.
And this is not a government problem, this is a consumer problem.
Well, of course it is, because with all the fraud, we pay for that.
Right,
You
we
know,
sure do.
it doesn't just get paid by somebody else. It
Most
gets
certainly does not.
folded into the cost of the program, and
Absolutely, absolutely. So if we want Medicare to be around for future generations, we all need to do our part to help mitigate fraud,
okay.
okay? So how do we do that, right? So SMP advocates these 3 steps to avoid fraud. So
Okay.
it's protect, detect, and report. So what's meant by protect? So first off, we say treat your Medicare card like a credit card.
Okay.
Do not give that number out to anyone you don't trust, okay? If you don't think you're gonna need the card, don't carry it with you, just like a Social Security card, right? You don't need to carry that with you all the time,
Okay.
right? So leave it at home if you don't think you're gonna need it.
And I carry mine all the time,
Mm-hmm.
along with my other 2 insurance cards, so.
Well, it's risky. If your wallet is stolen, that number is now out there, and you're going to need to go and get a new card,
Okay.
right?
Well, that is good advice. I had just never thought about it.
Yeah.
Just
Yeah.
like the insurance card I used to carry all the time before, I just threw it in my purse. and-
Exactly.
Okay.
Exactly. Yeah. And finally, do not respond to offers for free medical services or equipment. You might get a phone call saying, "Would you like a free neck brace?" Right? Sounds
Right.
great. You're not going to get a bill, right? Give me your Medicare number. All right. So you won't specifically get the bill. Medicare gets the bill, which again is that consumer fraud problem, right?
Correct.
You may or may not get the brace, and if you do, it probably is not going to be a very good one.
And I have to say, I got a call just the other day from somebody claiming to be Medicare, and they wanted to talk to me about my options, and I said,
Nope.
you know what, I don't think I need to talk to you, and I hung up.
Absolutely. Medicare is not
Because-
going to reach out to you unsolicited,
That is what I thought.
just like the IRS.
And I was
They're
really
not, yeah.
irritated that this company was, for all intents and purposes, saying they were Medicare,
Mm-hmm.
and they were calling me. It was
Mhm.
very deceptive.
Mm-hmm. Absolutely.
So the other fraud that I have heard about is that they will call and have people take genetic tests for
Oh, yes.
this, that, or the other thing.
Absolutely.
When they don't actually need the test,
Mhm.
and it gets covered, but then when they actually need the test, they don't get to get it again.
Mm-hmm.
So it's, one of those things that might not bite you at the moment, but it
Later.
sure can come and bite you in the butt later.
Right.
Yeah.
And it's not that the genetic test is the problem. It's not that the back brace is the problem. The source of where you're getting these things is the problem. If your doctor wants you to get a brace, if he wants that genetic test for you, he will order it, right? So the whole
Right.
adage of if it sounds too good to be true, it is, definitely applies to Medicare fraud,
Okay.
okay?
And are those the biggest types of frauds, people trying to get you to take medical equipment that you don't need or it's substandard?
Mm-hmm.
Are there other Medicare frauds that people should look out for?
Hospice fraud.
Oh,
Hospice,
geez.
yeah.
Okay.
So you'd think that would be a red flag easily detected, but apparently it's not. So scammers entice beneficiaries with someone will come to your home and give you home health care.
Okay.
Someone will come to your home and help you dispense medicines. But hospice care is for terminally ill patients.
Right.
So if you're not terminally ill and you sign up for it, you will find out in short order that you have been scammed because you won't be able to pick up your prescriptions. You won't be able to go and see your regular doctor because once you're on hospice care, your care is extremely limited. For example, the only prescription drugs you will be able to pick up is for pain,
Okay.
right? So all of your normal prescriptions, nope, once Medicare says you're on hospice care, you won't be able to pick up your normal prescriptions. Okay, so hospice fraud is a huge one.
Okay.
Yeah, yeah. But when you go to the website, there is a link on there. It's called Fraud and Abuse, and that's a
Okay.
great place to go for all the current frauds.
Oh, that's good to know.
Absolutely. And then when you
Yeah.
sign up for that newsletter, that's the kind of thing that they're going to alert people to, right?
Sure.
Right. So, I mean, during COVID, bogus tests, that was a huge thing. We're not seeing that as much anymore, but absolutely, still bogus tests are out there, kind of a thing.
Okay.
So, yeah. So after protect is detect. And what do we mean by that? So we mean that, we'd like you to just make some simple notes in a calendar, right?
Okay.
Who you saw and when,
Sure.
right? When you're picking up a prescription, what did you pick up? Where did you pick it up from? What date, what time, well, not the time, but certainly the date, what it was, the pharmacy, how much you were charged.
Okay.
So when you get your Medicare summary notice in the
Mhm.
mail, when you get your explanation of benefits from your prescription Part D plan, then
Okay.
you can do a quick audit, right? So what are you looking for, right? You're looking for billing errors, you're looking for duplicate charges, you're looking for services not rendered, you're looking for prescriptions not ordered. So
Okay.
when you're looking at your Medicare summary notice, right? So it's going to list who you saw and when. Did you? Is that the date that you went in to see that doctor? Is that doctor even someone that you're seeing? If he's listed, perhaps it's Dr. Smith located in Connecticut and you live in Ohio,
Right.
okay? And duplicate charges that you might be seeing, okay?
You know, that's a really good thing to put that on your calendar, because what I have found is that I'll go see my eye doctor in June and I'll get a bill from him in December.
Mm-hmm.
And by then I'm like, what? I did what?
Exactly.
Yeah.
Exactly. So, and when you're getting your explanation of benefits from your drug company, again, it's going to list what you picked up and when, and the charge and the pharmacy. So is that all accurate? Right?
You know what? I've had things denied before because they put the wrong
Code.
code in.
Mm-hmm. Now that sounds like just human error. So
Oh,
if you
yeah.
detect something wrong, we always recommend that you call and speak to the healthcare provider.
Sure.
Right? Because that could be just a human error. But if it's not, then we recommend that you give us a call, your local HICAP office, or you can actually contact the SMP fraud hotline and report it to them.
Okay.
And then they'll get started on investigating and figuring it out.
Yeah. Well, I just think it's important because, yeah, this is actually kind of hard to figure out what's being covered, what's not being covered. And my big shock was when I got a bill for my yearly visit to my doctor, and I thought that was covered, which, oh yes, it is, but it's part of your deductible. So that was a big shock for me because, I didn't get a bill for my mammogram. I didn't get a bill for that kind of routine stuff. And then suddenly I got this bill for my annual visit. So it was really interesting.
Did they know it was a wellness visit? Was it coded as a wellness visit?
I don't know, so maybe I need to find that out.
Yes, because a yearly wellness visit should be covered.
And it shouldn't be part of my deductible? That is good to know, so I will make sure that happens in the future.
Yeah, absolutely.
Okay.
So, yeah. So again, the website is great. That fraud and abuse tab is provides just a plethora of information about the current frauds. So like we talked about, the genetic testing, the braces, hospice, whatever's up and coming or, is becoming more prevalent, that'll be reported on there for education purposes.
Sure, and I think COVID testing and things
Oh,
like
yeah.
that ended up in the fraud department a lot of times.
Absolutely,
Yeah.
absolutely. Yeah, free tests. Yeah, just give me your
Right.
Medicare number kind of a thing. Yeah,
Yes.
yeah, and whether or not you'll get the test or whether or not it's a good test, an accurate test, that remains to
An
be seen.
in-date test.
Exactly.
Yeah.
Exactly. So, yeah, so that's Senior Medicare Patrol.
All right. So we have report, and we've actually talked about this already.
Right.
So,
Right. So, yeah, calling the healthcare provider. If you suspect a problem, report it. If it's not a human error, kind of a thing. And then, yeah, here's this fraud and abuse tab that you can click on, again, on that website, the cihealthadvocates.org. And then, yeah, so that'll give you all kinds of information about the current frauds.
oh, well, that sounds like a tab I'm going to be clicking on when I go home today.
And maybe get that monthly newsletter.
I think that's a great idea. So thank you.
You're very welcome.
All right.
You're very welcome.
Do you guys have any questions? No? All right.
Super.
And is there anything else you'd like to tell us today before
Nope.
we wrap up?
Nope, that'll do it for me.
Okay, so why don't you give us the local number for our HICAP people right now?
So local is 209-532-6272. So, yeah, again, open 5 days a week, 8 to 5, closed at lunch. Yeah, give us a call. We can certainly answer questions over the phone. Or you can come in, certainly, and sometimes, certainly with reviewing drugs, new to Medicare, it's good to come in person because we give you a lot of written information.
Okay.
So if you're not looking at the information together, that
Right.
can make it harder.
Oh,
That can make it harder.
absolutely.
So, yeah, so we encourage people to come in.
Okay, and then I believe every year you do have some counseling appointments that you do out in Calaveras County, Tuolumne County, and Amador. Usually, I know at
The senior centers, absolutely, absolutely. So you don't necessarily need to come to Sonora. So we
Okay.
do have counselors in all but Alpine County.
All right.
So yeah, you can come to your local senior center,
Okay.
and we have volunteers that work there. But all the appointments are done through the Sonora office. So
And-
you need to call them anyway.
Sure, and then when do those appointments start? When do you start making the appointments?
Oh, the appointments are year-round.
Oh,
If
I
you're-
did not know that.
Oh, absolutely. Now, it sounds like what you're talking about is prescription Part D open enrollment. And
Okay.
that is between October 15th and December 7th.
Okay,
But that is strictly focusing on prescription D.
okay. But
Yeah,
that's
Part D.
also the time period in which you can change your Medigap plan without going through the,
No,
no, okay.
no,
So,
no. Medigap plans need to be reviewed your birthday plus 60 days.
oh,
It is a
okay.
very different time period.
I had no idea.
Mhm. Yep, so the
All
only
right,
thing you're
so-
doing between October 15th and December 7th is reviewing your prescription Part D drug plans for the coming year.
Okay. And then I have to review my Medigap plan between March 1st, April, May,
Well, whenever your birthday is,
so March 1st. which
plus
makes it
60
easy.
days.
So that'd be March.
Now, you can do it
April,
any day of the
say up
year.
to May.
You can do it any day of the year. But the whole idea is to avoid medical underwriting.
Right.
And that is done your birthday plus 60 days.
Well, if I learned nothing else today, I'm really glad I learned that because I was under
Absolutely.
the impression I had to do all that between October and December and I never do it, so
No,
it just rolls over like from last year. I just keep everything.
absolutely, absolutely. And I mean, you can stay with your Medigap plan forever, but the
Okay.
premiums do tend to go up. And it's important to know that regardless of where you get the Medigap plan from, the benefits are all the same.
Oh, that's good to
It is
know.
irrelevant where you're buying it from, but the premiums can be very different. Right? So when you're talking about Medigap, you want to focus on price
Okay.
because it doesn't matter where you get it from. The benefits are the same.
So a G plan is a G plan is a G plan? Is that
Sure
what you're
is.
saying?
Yes, it is.
Now let me ask you about the drug plan. I go with the lowest price I can find. 'Cause
Absolutely.
I basically have no prescriptions. I have one that I fill every 6 weeks. If my health condition would change and I decide that I want more coverage, am I also getting penalized because I didn't get a beefier drug plan right from the beginning?
Well, none of us have a crystal ball, so none of us know what we might be prescribed in the future, right? So when you sign up for a plan, you have that plan for the year, okay? There is no changing once you get it.
Sure.
Now, if your doctor prescribes something that is not on the formulary, and what's a formulary, right? The formulary is the list of drugs that drug plan covers. Okay, so if it's on the formulary, no problem. If it's not, your doctor will work with the insurance company because the insurance company will say, well, can this patient take this instead?
Okay.
Okay, that is for your doctor to decide, not the insurance company. So
Right.
your doctor will either say, yes, that's all right, he'll change the prescription and you're good to go. If you can't take what the insurance agent or the insurance company is recommending, the insurance company will cover that drug for the remainder of the year, period. So you better get in at the end of that year and change your plan.
Okay.
Because what that means is for the coming year, it will not be covered.
Okay.
Okay, so that's the time when you would want to then review it and you add that new drug onto your list. And yes, it's going to recommend a change because that drug is not on the formulary for the plan that you currently have.
Oh, I had no idea it was doing that behind the background.
Mm-hmm.
I had no idea why you listed your drugs in the first place.
Oh, absolutely,
That is good
absolutely.
to know.
And when you do that on the Medicare.gov website, whether you do it or I do it, that information doesn't go anywhere. That is
Oh,
just a
good.
tool to figure out what plan to use, what plan is best. And when you go to the website, there are 26 drug plans for 2023, okay? It changes every year,
Wow.
right? Some come and some go, right? When you come in for counseling, we're not talking about 26 drug plans. We put in your drugs, and the Medicare website automatically sorts it by the lowest drug and premium cost at the top of the list. So that's the one we're going to focus on.
Okay.
Right? We're not going to go through all 26 and try and figure that out. Right?
Thank goodness.
Medicare does that for us.
Well, that's really good to know.
Absolutely. So then we review the plan details, right? And we talk about what the premium will be. We'll talk about what the deductible will be, right? And if
Okay.
your drugs are simple enough, they may not even get applied to the deductible,
Right.
right?
That's kind of where I fall. I don't
Yeah,
even.
absolutely. A simple tier 1 drug, it doesn't even get applied to the deductible, right? Which is
Exactly.
usually about $505 a year. So we review the plan details with you, and it matters what pharmacy you go to, for sure.
Okay.
So we look at that too. So in your zip code, is it cheaper to go to CVS or Rite Aid or Walmart? And it can make a big difference. And mail order is not always the cheapest. People tend to think it is, right? Not necessarily.
Well, in certain prescriptions, they used to be able to send you 90 days worth, and now there's those prescriptions. You're lucky if you get them 30 days at a time now. So the the mailing has changed a little bit too.
Right,
Yeah.
right. And then mail theft makes
Right.
people nervous.
Oh, I hadn't thought about that.
So how comfortable are you with that, being put in your mailbox every day? If it's a locked box, that's one thing. If
Right.
it's just a regular mailbox, maybe you don't want to go down that road anyway.
That's
But those
true.
are the things we look at. So once Medicare.gov says, you should be in Plan A, then we review the plan with you. And we let
Okay.
you know the premium, again, what the drug is going to cost you per month, and the best pharmacy to go to,
Okay.
right? And if you're not willing to change your pharmacy, that's fine. But we want you to know. We want to educate you. And then the decision is yours, because some people don't want to change their pharmacies.
Well, it's a comfort. I went to Kelly's for years, and then they closed, and now when San Andreas opened up, I really like going to San Andreas. It's a little small
Okay,
pharmacy, and it's close,
okay.
and they give me advice on how to get through Medicare
Exactly.
applications.
Now, it
So
sounds like what
that-
you're taking is very simple,
It is.
so it might not matter if you go someplace else. But if you should take something more complex, Kelly's might not be the best bet for you.
That is true.
And the choice then is yours. Do I want to pay that extra to go see Kelly's because I like them? It's a neighborhood pharmacy, I want to support them.
Right.
But that decision is yours.
Okay.
So what we do is educate you.
So what we haven't talked about today is the dreaded donut hole. And I have heard rumors that the donut hole was going away, but where are we
Yes,
with that?
so that was part of Biden's Inflation Reduction Act. I think it's
Okay.
2025, so you can do the Google research on
Sure.
what's all part of that. But I think it's 2025. The donut hole is supposed to go away, and everyone is capped at $2,000 a year, which is huge because as part of the whole prescription drug plan, catastrophic coverage is over $7,000 a year. What that means is you and your plan together have shelled out $7,000. It's a lot of money,
That is a lot of money.
right? So for people that get to that level, to be capped at $2,000 is huge. Now for someone like you, you're not even going to get close to $2,000, right? You're not even going to
That's
get close
true.
to your donut hole, okay? But that's 2023, right? We don't know what's in store for you. Hopefully, you'll stay on the very simple drug you're on forever.
Hopefully that will be the case.
Absolutely.
Yes.
Absolutely. So yeah, so that getting rid of that donut hole will be huge.
I think so. And then the other thing that I'm so thankful for is the insulin
Oh,
coverage.
yes.
The reduction in the insulin.
And that was all
cost
part
for
of the
people.
reduction, yeah, the Inflation
Yeah.
Reduction Act as well. Yeah, because a lot of people are diabetic.
They are, and I have a friend who is diabetic, been diabetic since he was a kid.
Yeah.
He makes too much money for covered California.
Ah, okay.
But not enough to actually get an insurance plan because it's so expensive for him. So the insulin, I think about him every time I hear those notices on TV about the insulin drug prices because I think about him. It's got to have helped him an immense amount.
Oh, good. So he has turned 65 then?
Not yet, but
Oh,
it will.
okay.
So-
Okay. All right.
But even so, I mean, insulin is something you obviously can't just do without.
Exactly. Exactly.
So I'm really glad they've brought the cost of that down.
Absolutely.
Yeah,
Absolutely. No, that was great. That's great. So, yeah.
all right. Well, thank you for coming and talking to
Oh,
us
you're so welcome.
today.
You're so welcome.
I have learned so much, and
Terrific.
I thought I knew a lot about
Excellent.
Medicare and HICAP, and
Excellent.
so,
Excellent.
and
Well,
I'm
yeah.
really excited to check on the fraud and abuse tab because
Terrific.
there's new scams coming through all the time, and I tell you what, now they've got robots doing it, so you can't even tell them to stop
Yes.
talking. They just keep going.
Yeah,
like
hang up. Just hang up. It really is best, right? If
really
you don't know
is.
that number, for heaven's sake, if it's important, they'll leave a message.
that is my philosophy.
Absolutely. If you don't know the number, yeah, just don't go down that road.
All right.
Don't go down that road. But yeah, come in and see us. I mean, I know all of our goals. Mine specifically, when I have people come in and they're confused and they're scared, and I guarantee them in an hour's time you will feel empowered and educated, and they are,
Wonderful.
and they are. So yeah,
Perfect.
super. Well, thank you, Susan.
You
Thank you
are-
for letting me come in today.
I'm glad you were here.
Super.
Thank you.
Me too.
Okay.